Greetings, everyone. My name is Dr. Francoeur Cadet, infectious disease doctor and internist. And I want to talk to you about cancer. And we are going to talk about uh, 5 different types of cancer: skin cancer, lung cancer, breast cancer, prostate cancer. And we're going to talk a little bit about the stages. And we're going to talk about how they can metastasize, how they can travel throughout the body. And this is courtesy of the Cadet solution for the body and soul. If you really like this video, please share it and press on the like button. Let's get started. Cancer and epidemiology. Cancer cells develop because of multiple changes in the genes. These changes can have possible causes: lifestyle habits, genes you get from your parents, and being exposed to cancer-causing agents and the environment can all play a role. Many times there is no obvious cause. Cancer affects 1 in 3 people in the United States. Chances are that you or someone you know has been affected by cancer. Now, keep in mind that we are made of trillions of cells that over our lifetime normally grow and divide as needed. When cells are abnormal or get old, they usually die. But cancer will start when something goes wrong in this process, and the cells keep making new cells, and old and abnormal ones do not die when they should. That's the problem. As the cancer cell grow out of control, they can crowd out as abnormal cells. And this makes it hard for the body to work the way it should. For many people, cancer can be treated as successfully. In fact, more people than ever before, they can actually lead full lives after the cancer treatment. Basic understanding of the human body. The human body is composed of cells, tissues, organs, and the organism, which is you. What are the types of cancer? There are many types of cancer. Cancer can develop anywhere in the body and is named for the part of the body where it started. For instance, breast cancer that starts in the breast, breast cancer that starts in the breast is still breast cancer, even if spread to other parts of the body. There are 2 main categories of cancer. Number 1 is the hematologic or blood cancers of the blood, including leukemia, lymphoma, and multiple myeloma. The other type is the solid tumors. They are cancers of any organ, body organ, or tissue of the body. The most common solid tumor are breast, prostate, lung, and colorectal. These cancers are alike in some ways, but they can be different in the ways they grow, spread, and respond to treatment. Keep that in mind. Some cancers grow and spread fast, others grow more slowly. Some are more likely to spread to other parts of the body. Others tend to stay where they started. Some types of cancer are best treated with surgery. Others respond better to drugs such as chemotherapy. Often 2 or more treatments are used to get the best results. Now, it is important to understand the difference between tumor and cancer. What is tumor? A tumor is just a lump or growth. Some lumps are cancer, but many are not. Keep that in mind. Lumps that are not cancer are called what? Benign. But lumps that are cancer are called malignant. What makes cancer different is that it can spread to other parts of the body, while benign tumors do not. Cancer cells can break away from the site where the cancer started. The cell can travel to other parts of the body and end up in the lymph nodes or other body organs, causing problems with normal function. Now, we're going to talk a little bit about specific cancer. The first one is skin cancer. What are the signs and symptoms of skin cancer? How do you describe them? Well, first of all, when you have a little spot on your skin, or some lesion on your skin, you have to look at the A, B, C, D, E. A for asymmetry. If you draw a line through the middle of the mole or the lesion, the half of the cancer won't match in size. B is border. The edges of an early melanoma tend to be uneven, crossy, or notch. C, you have to look at the color. Healthy moles are uniform in color. A variety of color, you have to be aware of that. Be aware of a variety of color. Usually, if you have different colors, it's a bad sign. D, diameter. Melanomas are usually larger in diameter. E is evolving, whether things have changed, whether the lesion or the mole that you see is changing. So that's why you have to let your doctor know. And what about lung cancer? Well, signs and symptoms of lung cancer, usually patient will present with hacking cough, shortness of breath, loss of appetite, bleeding. When you cough, you're coughing up blood, lump in the neck, your lymph nodes, chest pain, generalized weakness, right-sided abdominal pain, blood clots all over the body, and weight loss. So those are some of the signs and symptoms that you may have lung cancer. What about prostate? Some of the signs and symptoms of prostate cancer include frequent urination, weak or interrupted urine flow, blood in the seminal fluid, and then you may need to strain to empty your bladder, and you may have blood in the urine, pain or burning during urination, and then you may have the urge to urinate frequently at night. And also some men have erectile dysfunction. And now what about breast cancer? Signs and symptoms of breast cancer, you may have a retracted or inverted nipple. You may have breast or nipple pain, and you may have some lumps in your breast. Now, remember, not all lumps are equal. Some women have lumps just because, as a benign thing, but some women may have lumps because it's serious. Also, nipple discharge, breast swelling, redness or rash. And if you have change in the skin texture, be careful. And if you have a lump around the collar bone or underarm, you need to get that checked out. What about colon cancer? Well, some of the early signs and symptoms of colon cancer include constipation. You may also have diarrhea, blood in the stools. If you have very narrow stool, like a pencil-like stool, unexplained diarrhea, unexplained anemia, tender abdomen or abdominal pain, and then unexplained weight loss. So if you're losing weight and you're eating, you need to get that checked out. What about cancer stage? Now, when the cancer is found, there are tests that are done to see how big the cancer is and whether it has spread from where it started. And if it's spread from where it started, it's called metastasis, and that's how you can stage it. Now, a lower stage means that the cancer has not spread very much. A higher number, such as stage 3 or 4, so when you hear stage 3 or 4, it means it has spread more. Stage 4 is the highest stage, okay? The stage of the cancer is very important. Why? Because this is how your oncologist, your cancer doctor will choose treatment for you. So you have to ask your doctor about your cancer stage and what it means to you. Whenever they say you have prostate cancer, breast cancer, lung cancer, ask your physician what is the stage in order to determine what the treatment course will be. And how does cancer spread? Well, cancer can spread where it started to other parts of the body. When cancer cells break away from a tumor, they can travel to other areas of the body through either the bloodstream or the lymph system. Cancer cells that travel to the bloodstream may be able to reach distant organs. If they travel to the lymph system, the cancer cell may end up in the lymph node. So it's really important that you get that checked out. In order for cancer cell to spread to new parts of the body, they have to go through several changes. They first have to be able to break away from the original tumor and then attach to the outside of a lymph node or blood vessel. Then they must go through the blood vessel wall to flow with the blood or lymph to a new organ or lymph node. So it's really important to understand this concept of metastasis. Now, how do you remember which cancer go where? For example, for bone mets, if you have metastasis to the bone, you can think of mom by the kid's lung pain. So mom M, multiple myeloma go to the bones, by breast go to the bones, the thyroid and testis cancer, testicular cancer go to the bones, kids, kidney go to the bones, the lung go to the bone, lung cancer go to the bone, and the pants, P for prostate, go to the bones. Or if you want another way to remember what cancer go to the bones, you can remember bless the kiwi and papaya. Fruit time. So you got to think of fruit to stay healthy, right? So bless, BL, so B for breast, L for lungs, the thyroid cancer, go to the bones, and then kiwi, K for kidneys, and then papaya, prostate. And then if you want to remember what type of cancer go to the brain, you have to remember these mnemonics. Lots of bad stuff kill glia. So lots of lung cancer go to the brain. Bad breast go to the brain. Skin stuff, skin go to the brain. Other bad kills, kidney go to the brain. And then glia for GI can go to the brain. What about liver mets? The cancer that goes to the mets, to the liver. You can remember by the cancer sometimes penetrates benign liver. So cancer, colon goes to the liver. Sometimes stomach goes to the liver. Penetrates, pancreas go to the liver. And benign, breast go to the liver. And then lung, benign liver, remember benign liver, lung can go to the liver. So this is it. If you really like this presentation, you can share it and click on the like button. Thank you very much. And next time, we will talk about an important topic. Thank you very much for watching, and we will see you on the next video. Thank you. You have a blessed day. And remember, this is courtesy of Cadet Solution for the Body and Soul. Remember, this shirt that I'm wearing right now, as you can see, here it is. Cadet Solution for the Body and Soul. That's what the front says, and the back, it has a great slogan, push, which is pray until success happens. And you can have it for free if you use the service, the telehealth service online, and or if you can share it with your friends. And if your friend use it, you can have this t-shirt, dry fit t-shirts for free. You can get on with the website, Dr. Cadet Solutions.com. So Dr. Cadet Solutions.com. So DrSolutions.com. Thank you very much. Have a blessed day.